Have you ever found yourself waking up in the dead of night pondering why your sleep is so fragmented and elusive? Maybe, as the years go on, you recognize your rest is not as restorative, your nights are interrupted, and your mornings feel heavier. My name is Dr. Lauren Pierce, specialist in sleep medicine and neurogerontology. Today, I will share with you an extended story that might reshape your understanding of sleep and well-being. George Müller, a retired German professor, spent decades teaching neurobiology at the University of Tübingen. Like so many in his age group, over 70, George began to experience frequent nocturnal awakenings, sometimes at 3:30 or even 4 a.m. Initially, he dismissed these disruptions as simply a consequence of aging or stressful academic deadlines lingering in his memory. But George was also scientifically curious. He began logging his sleep using actigraphy and polysomnography, wanting to uncover the root of his insomnia and early morning arousal. What George discovered resonates deeply with the physiology of aging. With age, the architecture of sleep undergoes profound transitions. Deep, slow-wave sleep, SWS, stages N3 NREM, is curtailed. Instead, lighter sleep stages, N1 N2, dominate the sleep cycle. Research at the European Sleep Research Society shows that after age 65, slow-wave sleep may diminish to less than 10% of total sleep time. Even minor changes in ambient noise, discomfort from osteoarthritis, or subclinical anxiety can jolt the aging brain from sleep. But beyond mere architecture, there is a neuroendocrine explanation. Melatonin, our endogenous sleep hormone, is secreted by the pineal gland beginning at dusk, reaching peak levels between midnight and 3 a.m. In elderly adults, melatonin secretion can drop to 50% of younger levels, according to the European Journal of Endocrinology. This results in sleep onset occurring earlier, decreased nocturnal sleep maintenance, and a predisposition to early morning awakenings. Another pivotal factor is the cortisol awakening response, CAR. In the pre-dawn hours, especially between 3 GAUs and 5 a.m., the hypothalamic pituitary adrenal axis ramps up secretion of cortisol, our primary stress hormone. Studies from the University of Vienna indicate that a dysregulated CAR leads to premature arousal, increased heart rate, and heightened alertness, precisely when one hopes for deep, peaceful sleep. George, equipped with this understanding, became less anxious. But crucially, as a medical professional, I observed 3 critical mistakes that many make when waking up in the early morning hours. First, checking the clock, whether an analog watch or smartphone. The temporal cortex is activated, inciting anxious arithmetic. How many more hours of sleep can I salvage? Each time the brain registers the threat, the amygdala is stimulated and cortisol surges, further sabotaging any chance to return to restorative sleep. This phenomenon is confirmed by a multi-center study from King's College London published in Sleep Medicine, showing that clock-checking behavior is strongly correlated with perpetuating insomnia. Second, remaining in bed and forcing oneself to sleep, termed conditioned insomnia. When the brain associates the bed with frustration, anxiety, or wakefulness, it undergoes maladaptive conditioning. Functional MRI scans in older adults show that the hippocampus, responsible for contextual memory, starts to encode the bed as a site of arousal, not rest. The Society of Behavioral Sleep Medicine recommends stimulus control therapy. If you cannot return to sleep within 20 minutes, leave the bed and engage in quiet activity like reading under dim light or listening to ambient music without screens. Sophia Schmidt, an Austrian retiree, suffered for years from middle-of-the-night insomnia. She would lie awake, worrying about family, health, and even trivial matters. After adopting stimulus control, getting out of bed to stretch or practice guided imagery visualization, Her sleep efficiency improved dramatically, and her morning mood stabilized. Third, drinking large quantities of water upon waking, believing hydration might relax the body. However, the renal system in older adults cannot regulate nocturnal diuresis efficiently. Recent studies in geriatric nephrology demonstrate that overhydration at night leads to multiple nocturia episodes, further fragmenting sleep and prolonging wakefulness. Instead, mild sips to soothe the throat, not more than 10-30 milliliters, are recommended. Hans Müller, an Italian-born engineer living in Luxembourg, shared that reducing nighttime water intake from a full glass to just a few sips shortened the time it took him to return to sleep by over 30 minutes. Beyond what you must avoid, clinical practice now supports transformation of nocturnal awakenings into a therapeutic window. Method 1. Passive relaxation and thermotherapy. After waking, leave the bed quietly. Drink a small cup of warm water, not hot nor cold, then spend 5 to 10 minutes performing gentle hand and foot massage. Warm water causes peripheral vasodilation, transiently raising skin temperature and facilitating parasympathetic dominance, which supports drowsiness. Massage stimulates peripheral mechanoreceptors, releasing endogenous opioids and modulating the sleep-wake circuitry via the thalamus. George Miller found, after weeks of this practice, that his anxiety subsided. His sleep latency, the time taken to return to sleep, halved. Method 2. Gratitude. Journaling and worry container. Cognitive technique. If rumination clouds your mind at night, have on your nightstand a small notebook and an opaque box. Begin by listing 3 things you were grateful for that day. Even the simplest observations work. Then, note the worries occupying your thoughts, writing each on a slip of paper and inserting them into the box. Psychiatric research from the Karolinska Institute in Sweden shows that gratitude journaling activates the left prefrontal cortex, supporting emotional resilience. The act of externalizing worries, physically placing them in a container, interrupts perseverative cognition loops and frees the mind for relaxation. Sophia Schmidt reported over 3 months a marked reduction in nocturnal anxiety and overall improvement in sleep satisfaction. Method 3. 5-4-3-2-1 Sensory Grounding Mindfulness Meditation. Embraced across European clinics, this method uses full sensory immersion to disengage catastrophic thinking and root consciousness in the present. When awakening, first identify 5 things you can see: the curtain, the ceiling pattern, bedside lamp, book cover, your own hands. Next, focus on 4 distinct sensations you can feel: the texture of your pillow, warmth of the blanket, the evenness of your breath, the heartbeat pulsing in your fingertips. Then, listen for 3 sounds: the ticking of the clock, distant traffic, wind outside your window. Identify 2 scents: faint laundry detergent on the pillow, cool night air. Finally, acknowledge 1 taste: morning dryness, or the subtle flavor of a sip of water. Neuroimaging studies in mindfulness show that such practice increases theta and sigma activity in the EEG, facilitating non-REM transitions. Hans Müller began using sensory grounding and noted, "For the first time in years, my mind stopped racing and sleep returned, effortless and gentle." Medical approaches do not end there. Under clinical supervision, a variety of interventions can be used for chronic sleep maintenance insomnia. Cognitive behavioral therapy for insomnia, CBTI, which has the strongest evidence base. This structured program addresses dysfunctional beliefs about sleep and implements behavioral changes. Chronotherapy, adjusting sleep and wake times systematically to retrain the circadian rhythm. Bright light therapy, administered in the early morning hours to reset melatonin production and realign the internal clock. Controlled clinical trials published in The Lancet indicate marked improvements in age-related insomnia after 4 weeks of morning light exposure. Pharmacological options include low-dose melatonin supplementation, prescribed with caution as larger doses or improper timing can actually impair sleep architecture. Short-term use of orexin antagonists, such as suvorexant or lemborexant, may decrease hyperarousal for those with persistent sleep onset or maintenance issues. In rare cases, low-dose doxepin has been approved in Europe for sleep maintenance without significant next-day sedation. For those with comorbid medical conditions, treatment of pain, nocturnal hypertension, heart failure, or depression is critical. Underlying disease may disrupt sleep far more than age alone. Non-pharmacological methods also play a role. Regular morning exercise, not within 3 hours of bedtime, modulates sleep pressure and builds homeostatic sleep drive. Maintaining strict sleep hygiene, consistent bedtime and awakening, cool and dark sleeping environment, minimizing screen exposure at least 1 hour prior to sleep, is validated as foundational by the European Sleep Foundation. Meditation, yoga nidra, and guided imagery are recommended adjuncts, especially for older adults with chronic insomnia or anxiety-related sleep fragmentation. In a multi-center European trial, over 70% of subjects reported sleep improvement after 3 months of daily slow breath meditation. The principle is that nocturnal awakening should not be regarded as pathology, but as opportunity. George Muller now welcomes his midnight awakenings as time for reflection and bodily care. Sophia Schmidt sees dawn as a peaceful window to list her gratitude, nurture calm, and mentally prepare for her day. Hans Müller no longer fears his sleep interruptions. He uses them to practice sensory mindfulness and finds his days are more energetic and focused. I, Dr. Lauren Pierce, urge you not to resent nocturnal wakefulness. Instead, embrace it as a gentle gift from the subconscious, an invitation to restore your body, mind, and spirit. Begin by discarding counterproductive habits. Do not check the time. Do not remain in bed frustrated. Do not drink large quantities of water. Replace them with evidence-based techniques. Massage and warm water for relaxation, gratitude journaling and worry container for psychological well-being, or full sensory mindfulness meditation for cognitive quieting. If chronic insomnia persists, consider consulting a sleep physician to investigate underlying medical issues or explore tailored therapies such as CBTI or light therapy. It is not necessary to transform your entire routine in one night. Choose one new practice. Allow yourself patience. Progress is measured in weeks, not hours. If you identify with George, Sophia, or Hans, or with any of these struggles, I invite you to share your journey with our community so others may learn and heal. If this story and medical guidance assist you, please subscribe to the Dr. Lauren Pierce channel for ongoing evidence-based insights into aging and health. Share this video with friends or family who may be struggling, so that together we can foster wellness and gentle sleep at every stage of life. May you find deep rest, tranquility, and ultimately, through mindful practice and compassionate care, a renewed and vibrant morning. Thank you for listening.